I'm Alex Morton. I'm a dentist and I'm very excited about to be joining Manish Bose at the IKON Dental Suite in Ealing. The purpose of sedation is to reduce anxiety. Dentistry is a scary business and no one wakes up in the morning and thinks, brilliant, I've got the dentist, or very few do. The idea is to take the edge off the day. So really we can offer techniques to make the whole thing a lot more pleasant. Time would go very rapidly. Your muscles would be very relaxed. And you'd know that you're at the dentist, but wouldn't care that you're at the dentist. Young people under 16 years of age, they respond best to nitrous oxide and oxygen sedation, which can be known as happy air or relative analgesia, various terms. But in a nutshell, it's delivering a mixture, a very safe mixture of oxygen and nitrous oxide gas to a percentage which is extremely safe and allows the patient to drift off into a little bubble of happiness and not really care that they're at the dentist and be able to accept procedures which they may be anxious about. Adults can have numerous ways. The least invasive is probably taking a tablet up to 40 minutes before the procedure. People who have trouble sleeping the night before could take a tablet the evening before. Some people even want to have a tablet when they wake up just to get them through the door. Okay, so a tablet would be a benzodiazepine drug, which is could be temazepam, clonazepam, diazepam. There are lots of PAMs, and we can choose the correct one for each medical history. The other way, which is very common for people beyond the age of 16, you can still use the happy air, gas and air, but often adults can be very beautifully controlled with intravenous sedation. This is where we find a vessel in the arm, normally, or the back of the hand, and we pop a very careful dose, monitored by lots of machines, to make sure it's very safe. This is still in the class of benzodiazepine drugs, the same as the ones you'd swallow, but in fact these ones are injectable, and it means that the operator, sedationist, has very tight control over the comfort of the patient. And also, for safety, the drug can be reversed. So actually within 90 seconds of giving the reversal agent, the patient feels they're entirely back in the room. They're very safe. They've got a great track record if the training is correct and the staff are correct and you've assessed your patient. So it's incredibly important to have a telephone consultation followed by a face-to-face, which is not a scary visit. It's just talking about any medicines that may be on board. We'd assess your height, weight to come up with something called your BMI, your body mass index, and just check generally that your heart and lungs are ready to receive this type of medication. There's no way in one administration you could possibly become addicted to them. I've been a member of a society called SAAD, the Society for the Advancement of Anesthesia in Dentistry, since 1993, and their motto is conquer pain, abolish fear. So the key with all of these techniques is very gentle language, very careful preparation of the patient so they understand what is going to be coming towards them, and an understanding of, also the limitations. This isn't general anesthesia. You're still conscious all the way through it. You know you're at the dentist, but you don't care that you're at the dentist. The safety is paramount, so we use extremely sophisticated machinery called pulse oximetry to monitor your heart rate and your blood pressure and the amount of oxygen in the bloodstream all the way through. Also, the staff training is incredibly important, so the dentist is always supported with at least one nurse, sometimes two nurses, but there'll always be two trained professionals in sedation in the room with you at all times. You'll never be ever alone. Here at IKON Dental, the first thing you could expect would be a telephone consultation from myself. That's without cost, and that would be a gentle introduction to what is going to probably be most suitable for yourself to get you through any scary procedure coming your way. The next thing would be a face-to-face meeting, around about half an hour. All the sort of scary dental equipment won't be on view. It'll be more of a conversation, checking your medical history and your current state of health. We do liaise with general medical practitioners as well to check any areas where there may be any concerns raised. After this, then the surgeon performing the treatment, which could be me or it could be Manish Bose or any of the other specialists, would take place, and they would have already given consent and information about the procedure that's planned, and I would know what that procedure is. One fabulous thing that's really exciting would be to rejoin some colleagues who I used to work with in Ealing. That's Dr. Yvonne Shishko and Dr. Elia Shiru. So I've been sedating for them for many years, and I'm excited to be able to start that service up, and also to work with Manish as well. So I've known him since 2013 when he was lecturing in Ealing, and I think a patient would need to know that you're in very safe hands with the surgeons here, and you'll be with a team of sedationists who understand the job and understand how to make sure things are managed beautifully. Sedation is one area of dentistry where you cannot graduate and go out into the wide world and begin sedating. You have to do postgraduate study. So I began sedating at dental school in 1992. In 93 I qualified, and I went straight into general anaesthesia and sedation at Guy's Hospital as a resident house surgeon. Most of the patients were undergoing head and neck cancer treatment and major oral surgery. I was also involved heavily with implant dentistry at Guy's Hospital. I continued that work in 95 in United Dental Hospital in Sydney, and then I came back to Ealing and ran my father's dental branch in West Ealing, and I introduced and set up a sedation service as a novel service in 96 in Hanwell, in fact. I've been sedating every week for, well, since 92. So plenty of years of experience, and the training is very important. So I did a diploma in dental sedation at Guy's Hospital, which is an intensive 6-month course. Also, I'm intermediate life support trained, and we have annual refreshers on medical emergencies and looking after compromised and very ill patients sometimes. I have had patients who are so terrified I had to go and sedate them in their cars on the forecourt. So the pathway to get them to accept dentistry can be quite meandering, but luckily most people are able to get into the building. And once I think they've met the team a couple of times, I think that can be very reassuring. But yes, there are many ways and means of getting people relaxed enough to accept dentistry at a very high level at this IKON dental suite. Mostly, have you messed around with my watch? Because how could 2 hours have gone past? Also, I just don't remember anything that just happened. I know I was here, but I don't really care that I was here. That was a very common thing to hear. Sometimes they say, did you do everything? And sometimes we say, well, we do need another session at some point, but actually we got a huge amount done. Most of the patients I've had for sedation become lifelong friends, actually, and some of my best patients I've ever treated are my sedation patients.